My name is Agnes Fogo. I am the director of the Renal Pathology Electron Microscopy Laboratory and Division here at Vanderbilt and hold the title of professor in the Department of Pathology, Microbiology, and Immunology. And I also have secondary appointments in the departments of medicine and pediatrics. Because Vanderbilt is such a collegial place and we interact so strongly with those key clinical departments.
Renal pathology is an interesting niche in which you get to apply many things you learn in clinical pathology to the anatomic realm. As one of the 4 renal pathologists, we welcome students from medical school as well as our own residency program to share a month with us in rotation, signing out cases from both native and transplant biopsies.
This involves interacting with our multidisciplinary conferences, teaching medical students when the medical students are in session, and getting to work the electron microscope directly. We have a wide variety of cases, and you get to see the light microscopy, the immunofluorescence, and also the electron microscopy directly and hands-on. We think it's wonderful for our fellows as well as our residents to have the interaction with our clinical colleagues and gather all the clinical information to be able to issue the very best integrated clinical pathological type of diagnosis. Our fellows work hard and they have a lot of fun. We have a great laboratory that is dedicated to renal pathology, so our processing happens separately from the regular surgical pathology and histology labs. We have special stains and special needs. Our technicians are wonderful. They are right next to where we sign out, and we have wonderful communications with them to be able to do the very best work on cases.
In renal pathology, I enjoy seeing more senior residents come through who have that foundational knowledge and can now apply concepts they learned in coagulation and heme path and surge path to now put together pieces from a patient history to what they're seeing on the slide to make a diagnosis.
Our fellowship involves graded responsibility, taking care of donor frozen sections. Occasionally we have weekend urgent cases where we're able to provide care for people who are really sick. And on a daily basis, we have the biopsies that happen within our hospitals here, from Vanderbilt, Veterans Hospital, and Vanderbilt Children's Hospital, and we get the mail from FedEx. About 80% of our volume, which is around 1,700 kidney biopsies a year, comes through FedEx every morning, and we pride ourselves on being able to give preliminary diagnosis from light microscopy immunofluorescence later that afternoon or early evening.